Hello, everyone. I just want to echo what Ed said. I'm so glad that you guys came to present today because, I'm thinking about this as a process that a work group got together probably a couple years ago to start planning, and we're just now getting ready to roll it out and test it. And as you guys kept talking about your lessons learned, I'm like, oh my goodness, didn't think of that. So everything that you said, everything that you said is valuable. I hope we will have access to the information that you presented today because I know that once we test this for the first time in Bloomsday and again in Hoop Fest, I know that we are probably going to be asking ourselves those same questions and, probably continuous process improvement. So anyways, my name is Erica Abner. I'm the Director of Clinical Operations at Multicare Deaconess Hospital, which is also the Region 9 lead DMCC. And as you can see, Mike's not here. He's here in spirit. So for the plan that we actually came up with a couple years ago when we started working on this, our concept of operations, this is kind of the scope that we came up with, which is identification and documentation of patients from the scene of a mass casualty incident, evacuation, or other circumstances that warrant activation of the DMCC through completion of their treatment course. Right now, that is our scope. Of course, when I heard you guys talking, it brings up that question, when does patient tracking end? Because really it could go on for quite a long time. I think one of the reasons that we started doing this is I think I do need to bring up, a couple of the reasons why patient tracking is so important, because lack of tracking patients can result in a delay of delivery of patient care, insufficient situational awareness. It can also hinder the ability of law enforcement, the medical examiner, and public health to effectively obtain, necessary information for their roles. But I think probably one of the biggest things, that's been mentioned here quite a bit today is family reunification. I personally can't imagine knowing that there was a disaster, a mass casualty incident, and not knowing where my loved one was, whether it be a child, even a friend. So I think the emotional impact for families is just so great on that. So our purpose, of course, that we came up with was patient identification, tracking patient movement and location. One of the great things about patient tracking and WATRAC, is we'll enter the patient information, but we also have the ability to update that if we should need to move patients to another location. Our role as the Disaster Medical Coordination Center, we do not, we want to try to minimize secondary transfers to other facilities as much as possible, but there are times based on the nature of the injury that will be, we can't help that. So we are able to continually update to follow that patient through their treatment course. Family reunification, of course, huge. Standardized, centralized documentation, situational awareness, and also to monitor the healthcare system's impact, the impact to our hospitals. Wish I wasn't so short. The stakeholders that we identified, and this is just a list of individuals who either have a role in patient tracking or who need the information from patient tracking. With respect to EMS are kind of going to be the ones who initiate this by placing unique identifiers on the patient, such as triage tags. The Disaster Medical Coordination Center will activate patient tracking in WATRAC. The hospitals will be the ones to actually register the patients once they come through the door and identify that this is a patient from an MCI or an evacuation. The Healthcare Coalition, Region 9, I just think of them as like the center of all, they just branched out everywhere. They just a fabulous organization. But local public health, Department of Health, local emergency management, medical examiner, and law enforcement. These are all agencies who really need this information. I'm not going to read over this, but this is the process overview that we came up with basically the process of patient tracking. And I do want to let everybody know that in the back, we have a copy of this that's up on the screen, and we also have our patient tracking plans. So if you're interested, grab one of those. They are in the back. And I just put this up there. I'm not sure if everybody in the room has gone through WATRAC training and has access to everything in WATRAC, but I just put a red arrow up there just to show that's where we find patient tracking in WATRAC. And I did also put up what patient tracking looks like, when we see it. we've been in there. A lot of us have been trained on it, but we haven't officially started using it yet. But anyways, in there, we do have the patient's name. We are able to place their unique identifier, with whatever triage color that they are, their age, if we have it. There's going to be times when we don't get all the patient information. But their tracking status, which is important because if it tells if a patient is en route or if the patient has arrived, or if we're transferring a patient if the patient has left, waiting for it to arrive at another facility, the location where the patient's at, and the date and time the status was updated. So the purpose of me presenting is that we are actually going to start rolling this out and test this for the first time during Bloomsday this year. Bloomsday falls on Sunday, May 6, 2018. The focus of exercising, last year, I guess I should say, we just kind of practiced our situational awareness communication in the command center. That was kind of the focus last year. The MCC sent out an incident advisory. We opened up the command center just for communication between the hospitals and all other participating agencies. But this year, we kind of want to focus on the patient tracking concept of operations. So with that being said, from 7 o'clock in the morning until 7 o'clock in the evening, all patients that are transported via EMS to our hospitals will be tracked in patient tracking. I know a lot of our hospitals have registrars that have gone through WATRAC training and are able to perform this function. Triage tags. So we had a discussion about triage tags. We will be having EMS place triage tags on all the patients they transport to hospitals during Bloomsday. We did have a nice conversation, about maybe we should buy special tags just for this event, but we thought we do have some triage tags. I believe Greater Spokane Emergency Management has some. So we are just going to use the ones we already have, not buy special ones for this event. But part of our after action review after this exercise is that we are going to discuss the triage tags and see if they actually meet our needs. If they do, great. If they don't, we'll discuss what we really need for the purpose of patient tracking for our region. The exercise roles and objectives. The DMCC is still going, I'm still going to do what we did last year and initiate an incident advisory, just letting people know, kind of as a heads up, Bloomsday is happening. It's an area with a mass gathering of people, which can have a great impact to our healthcare system. We will establish a command center chat room for entities, hospitals to communicate. Last year we had them just kind of communicate, let us know if you have any changes to your capabilities or limitations. And we kind of, also communicated if anybody had seen any patients come in from Bloomsday, but this year we will actually activate patient tracking in WATRAC. EMS, the role of EMS is going to be to ensure that triage tag placement is on any patient transported via EMS to the emergency department. Also asking that when they do bring any patients in from Bloomsday, they let the emergency department know this is a Bloomsday, a Bloomsday event patient who has a triage tag on, so that we can make sure to get them entered into patient tracking. And the hospitals, the expectations of the hospitals are to acknowledge the advisory, update their bed and agency status like we usually do, communicate their situational awareness in the command center in WATRAC, identify any patients transported from Bloomsday via EMS, and register all patient information into WATRAC. Like I said, we'll have an AAR post-exercise. I'm sure there's going to be a lot of reflection on that, a lot of questions, but I think it's going to be good. I'm really excited that we're finally rolling this out. We're also going to exercise this again for Hoop Fest on June 30th and July 1st. And I'm sure that we will probably present at a further Region 9 Healthcare Coalition meeting just to keep talking about what we're learning and any changes that we make. So. Are there any questions from anybody? Just for the purpose of us testing this out, boy, I'm loud. Sorry about that. Just for the purpose of us rolling this out for the first time, we are only going to track any patients from Bloomsday. And the same thing, we might expand the scope a little bit with Hoop Fest, to maybe any patients who come in, not just patients who come in by EMS. Hopefully by that point, all the hospitals will have triage tags to band walk-ins or people who drive up. And one more thing, one of the things that was pointed out to us is that on average every year there's about 30 patients transported via EMS to our local hospitals. And so for the scope of this exercise, we're probably just looking at local hospitals participating, so not anything rural or outside the area, just so everybody's aware of who will probably need to be participating. So.